Welcome to today's training session. COVID-19 is all over the news. But do you actually have an idea what COVID-19 is? Today's training session will provide you with details on COVID-19, what we can do to protect ourselves, and besides, we will go through what we have to do in case we feel sick. This session will take approximately 35 minutes. This training is not intended to spread fear or similar. It is provided to you to make you aware of the virus and to make you understand how you can protect yourself and others. For general knowledge, in December 2019, a new virus appeared in people. This virus is called Severe Acute Respiratory Syndrome-related Coronavirus 2. I know that sounds difficult, but luckily there is an abbreviation to it called SARS-CoV-2. This virus causes the disease Coronavirus Disease 2019, as it appeared the first time in 2019. In short, COVID-19. Since December, it spread quickly to other countries and has affected many people around the world. Hence, it is also called a pandemic. In order to know how we can protect ourselves against it, it is good to know how it gets transmitted. So how does the virus spread? COVID-19 can be passed from person to person. For example, when an infected person coughs, sneezes, or talks, they spread droplets of the virus out into the air. Those droplets then land on or are breathed in by other people. That is the most common way the virus can spread and is called droplet infection. Besides, it is known that people infected with COVID-19 can transmit the virus before the development of symptoms. It is also possible that people who remain asymptomatic throughout the course of the disease, meaning they do not show any symptoms, could transmit the infection. Hence, the best ways to protect yourself against it is to keep your distance, to follow the cough and sneeze etiquette, and to wear a mask. We will talk about those actions in detail in a moment to make sure they are applied correctly to provide you with full protection. What we also have to prevent that the virus keeps hanging in the air, called a transmission via aerosols. Hence, we need to ensure to ventilate frequently by bringing in fresh air to enclosed rooms. This will also help avoiding dry air, as when air is dry, this virus can easier attach to you. Best would be, of course, to stay whenever you can outside on the fresh air. Another way of transmission is by contact and smear infection, meaning if you touch someone who is ill or when an infected person coughs, sneezes, or speaks and spreads droplets of the virus, if those droplets land on surfaces, for example a door handle or the table, it can be passed from there to another person when touching the door handle or the table, and then touching the eyes, nose, or mouth. From there, the virus can easily enter your body. By the way, it is known that the virus has different lengths of surviving on certain surfaces, depending on the material. So what can be done to minimize the risk of spread? Do not touch your face with unwashed hands, maintain hand hygiene, regularly clean and disinfect possibly contaminated objects, and in general to minimize contact with objects. The less you touch any surface, the less chance there is for the virus to enter your body. One point on the side: transmission of the virus via food is very unlikely, as the virus is sensitive to heat and cannot multiply in food. However, if an infected person coughs, for example on food at the buffet, and you eat from it, of course you might get sick based on the way of transmission we just learned about. Hence, it is important to ensure high hygiene standards in all areas, in regards to the overall company, personal hygiene, and the product itself when preparing, handling, and offering food. So much about the ways of transmission, but let's have a look into the symptoms of COVID-19 when someone gets really infected. The disease basically affects your respiratory system. If you breathe in, you can feel where the air is going to. This is exactly the area that can get affected, so the lungs and the ability to breathe. Hence, the main symptoms of this illness are coughing and difficulty in breathing, plus fever, as the body strongly tries to fight the virus, which can be very exhausting, and hence another main symptom is tiredness. Less common symptoms include headache, sore throat, runny nose, problems with sense of smell or taste, and diarrhea. So as you can see, these are similar symptoms to a common cold. That is why it might be difficult to distinguish between. Plus, it often takes 2 to 14 days before people actually start to feel sick after being exposed to the virus. So you could be getting other people sick without knowing it. And this is what makes the virus so contagious. Just to give you an idea how the numbers of cases changed just within the last month, in March 2020, there were 132,000 cases reported worldwide, as you can see on the left side. And as of today, there are millions of confirmed cases. On the right side, you can see also here in the Maldives there are cases, and they have been significantly rising too. For up-to-date information, you can always visit the website of World Health Organization, or, in regards to Maldives, the dashboard of the Health Protection Agency. At the moment, there is no proven treatment yet available, like medicine or vaccines, so we have to use other ways of stopping the virus to spread, especially to prevent it spreading to our island. Because if the virus reaches here in our club, then we cannot get back into operations. Or once we reopen and we would have cases here, we would have to close the club again. So we must take this seriously. And luckily, there are certain actions we can and should take in order to protect ourselves, our colleagues, also our loved ones in case we go to visit them, and later on also our guests once we reopen. So let us have a look into those. The first measure we can take is to maintain proper hand hygiene. Really, it might sound simple, but it has a big impact, and it is considered as one of the most effective measures against COVID-19. As our hands are most likely to come into direct contact with the virus, as we are touching so many surfaces and objects within a short period of time, so we must ensure good hand hygiene to keep them clean and free from the virus. So what does this mean? Apart from overall personal hygiene, keep your fingernails short and clean. No hand jewelry is allowed except one engagement or wedding ring. Cover small wounds if you have on time and care for the skin of your hands so that no cracks will occur. Minimize contact with any objects, and when doing cleaning work, use disposable gloves. Plus, wash and disinfect your hands often and thoroughly. When? Hands shall be cleaned every time you feel or they are indeed visibly dirty. Besides, before and after eating or handling food, before touching your face, after using a tissue when coughing or sneezing, after visiting the toilet, after touching body fluids, for example when you change bed linen, immediately after removal of protective equipment, for example gloves or the mask, after using any equipment such as gym machines, before and after work, before and after any break during the working hours, when changing from one task to another, after any cleaning activity, and after handling waste. This is not a complete list, but shall give you a good feeling for when to wash hands. So definitely in any of these situations. And here's how to conduct proper hand hygiene. Number 1. Wet your hands with water. 2. Apply enough soap to cover all hand surfaces. 3. Rub your hands palm to palm and also clean your wrists. 4. Put your right palm over left outside with interlaced fingers and rub, and then vice versa. 5. Put your palms together with fingers interlaced and rub. 6. Put the backs of your fingers to the opposing palm with fingers interlocked and rub. 7. Take your left thumb with your right palm and rub rotationally, then vice versa. 8. Rub the fingertips of your one hand in circles in the palm of the other, and vice versa. 9. Rinse your hands with water until the soap disappeared. 10. Dry your hands thoroughly with a paper towel. At home you probably use a reusable towel. Make sure it is clean. However, in the optimum case, especially in public toilets, use a single-use towel. Plus, use the towel also instead of your hand to turn off the tap if it is operated manually. And then your hands are clean. This procedure should take approximately 30 seconds. This might seem long, but imagine, you just cut a pair of chili peppers and next you want to do is to put in your contact lenses. So you will make sure to do it thoroughly. It might be also helpful to sing a song while doing so. For example, we might all come from different places all over the world, but I think everybody knows the happy birthday song. So singing happy birthday twice would be the optimal length of proper hand hygiene.
Wet your hands with water. Apply soap, rub your hands palm to palm and wash the backs of both hands and in between your fingers. Then palm to palm with fingers interlocked. Clasp your hands together and rub. And then clean around the thumbs too. Rub your fingertips in the palms of your hands and finish off with the wrists. Rinse your hands really well with water and dry them thoroughly with a paper towel. Use the towel to turn off the tap. Your hands are now clean.
Hand washing in general is more effective than just sanitizing. But if you're not around soap and water, then sanitize your hands with an alcohol-based formulation. And here's how. Basically, the main steps are the same as for hand washing. But in the beginning, instead of water and soap, you're applying the sanitizer. And in the end, you have to make sure to rub your hands until they are dry. Then you will be safe. Washing or sanitizing your hands is a powerful tool. As the coronavirus is coated by a layer of fat, soap or sanitizer breaks that fat apart and leaves it unable to infect you. It also makes your hands slippery, and with the mechanical movements of washing or sanitizing, germs will be swept away. For this to happen, you have to take your time to wash or sanitize your hands, and you need to rub properly. Let's check out some other measures. What can help too is avoid touching your mouth, nose, eyes, and in general the whole face with unwashed hands. The virus can enter you via your mouth, nose, or even eyes, and that is why you need to protect especially your face, but in the broader aspect, of course, your whole body. Besides, maintain social distancing. This includes several aspects. First, to maintain a distance of at least 1.5 meter, which is approximately 5 feet. Every country and every institution may have own regulations. For example, the Maldivian law requests only 1 meter distance. However, our company and our future auditor require 1.5 meter, so please maintain in order to protect yourself and others. This applies to all situations, in offices, gateways when you are passing a door or walking down a staircase, at the public toilet, while being at the staff canteen, while working together with your co-worker on a project, while doing sport, in the pool, in your free time, etc. You can use tools such as trays during service to make it easier to keep your distance from each other. Plus, when you see floor markers, please follow them. They are there to ensure proper distancing. Also, a limit to the number of people per room might be applied. Second, avoid physical contact. This includes direct hand contact with people and objects. Hence, when greeting someone, no shaking hands, no hugging, no patting on the back, no bouncing, no high five or whatsoever. A smile and a verbal greeting will be just fine. Direct contact should also be avoided when handing over any items and when paying at a shop. Rather than paying by cash, it is recommended to pay cashless via online banking. You may want to use a paper towel or a tissue when using a door handle or light switch. Third, minimize social contacts, meaning avoid gathering in groups. This also applies to group sports such as volleyball, cricket, etc. Stay away from crowded areas. And besides, avoid traveling to a location that has a lot of COVID-19 cases. Social distancing is a helpful tool to reduce the number of germs that are spread and decreases the chance of getting infected. Luckily, nowadays technology is so advanced that we can still enjoy gathering with our loved ones while calling, video chatting, or playing online games, and so on. Let's get to the next measure. Where it is not possible to keep the required distance and there's no spatial separation, or in enclosed public spaces when not being alone, you have to wear a mask. For example, when you carry out an activity together with a colleague in a smaller distance than 1.5 meter, both of you must wear a mask. Masks can help us protect from airborne saliva that carry viruses, meaning when someone coughs or sneezes, it will protect us from the virus to come to us. But wearing a mask not only protects you, also others by reducing the chance of spreading the virus in case if you yourself are infected. That is why, especially when you're feeling unwell, you should wear a mask too.
Banana, papaya, pineapple.
Here's how to put the mask on. Tie your hair back if applicable. Perform hand hygiene, either with water and soap or hand sanitizer in the steps as discussed before. Take the mask by the straps. Check the mask if it is usable. For example, if it has holes or if it is wet or visibly soiled, it will not protect you. The mask must be complete and dry. Ensure which side is the outer and which the inner side. Plus, ensure where is the top and the button. Sometimes there is a little metal strap implemented indicating the top. Now, put each strap over one ear. Make sure you're covered from over the nose to under the chin. If there is a little metal strap, make sure it covers closely your nose. If you're reusing your mask and you touch the outside of your mask while putting it on, perform once more hand hygiene. When you want to take off the mask, perform hand hygiene as your hands might be contaminated. Take off the mask by its straps. Do not touch the mask itself and just rip it off as it might be covered by the virus. If it is a single-use mask, dispose it immediately in a closed-lid bin. If it is a reusable mask, it must be cleaned appropriately. Perform once more hand hygiene. Whenever it is applicable to wear a mask, you need to make sure to wear it properly to ensure it will give you sufficient protection. Hence, let's talk about some don'ts. Do not have the mask tangling like on one ear only. Do not pull the mask below your chin, also not above your head, for example when eating. When wearing the mask, it should always cover your mouth and nose. Do neither touch the outside of a mask in order not to get infected, as there the virus might sit on there, nor touch the inside in order not to contaminate it. Do not put it in your pocket when not using it. Do not keep it hanging on your arm. Also, do not share the mask. The mask is your personal equipment and shall not be used by anyone else. All of that can create opportunities for cross-contamination. So you might ask yourself, what can we do when we do not need the mask and it is a reusable one? Make sure to place it in a clean location, for example, by taking a disposable paper towel, half it, and place it in between. In this way, the mask can neither be contaminated by the surface nor by the air. For some of you, further protective equipment will be necessary. If so, your department head will inform you too and provide you with the equipment. Let's talk about another measure. Follow the cough and sneeze etiquette. When coughing or sneezing, make sure that no saliva or nasal secretions are spread into the environment. Meaning, when coughing or sneezing, you have to keep distance from other people and turn away. Do not cough or sneeze in the direction of someone else. You should catch your cough or sneezes best with a disposable tissue. Use the tissue only once, and do not just put it back into your pocket or just throw it anywhere. Dispose it immediately in the nearest closed-lid bin. If no tissue is available, do not just cough or sneeze into the air. Also, do not just put your hand over your mouth. Remember, most of the germs can be found on your hands, and you also don't want to infect someone else by contaminating the next door handle, for example. You should hold your flexed elbow in front of your mouth and nose when coughing or sneezing. In this way, you will ensure that germs do not get into the air that could contaminate other people. Besides, after blowing your nose, sneezing or coughing, wash your hands. And by the way, if you stand nearby a person who coughs or sneezes, it will not help to hold your breath, as the virus can be spread in many ways, as we just learned, like by touching contaminated surfaces and then touching your face. So it is better to ensure safe distance. In addition, do not spit on the ground, as in this way you would spread saliva, potentially carrying germs spreading the virus.
Make sure you cover your mouth and nose with a tissue when you cough or sneeze. If you don't have a tissue, cough or sneeze into your upper sleeve or elbow, not your hands. If somebody sneezes into their hands, that creates an opportunity for those germs to be passed on to other people or contaminate other objects that people touch. Make sure you put your used tissue in the bin, not on a surface where germs could spread. It's always important to perform hand hygiene, especially after you have coughed or sneezed.
Another effective measure is to clean and disinfect surfaces that you use frequently with COVID-19 proof liquid. This applies, for example, to door handles, phones, keys, wallets, glasses, light switches, and other items you touch a lot. Also make sure to wash work and leisure clothes regularly and hygienically. If you wash your clothes by yourself, use laundry disinfectant and wash at high temperature, at least at 60 degrees or even better at 95 degrees Celsius, if the material allows it. Besides, store your work clothes separately from your other clothes. And you also may want to take your shoes off when you enter your room, or if you used to walk barefoot, to wash your feet once coming to your room. Moreover, comply with company hygiene and documentation requirements. In the hospitality industry, exact adherence to given guidelines, such as HACCP, the analysis and control of hazardous points, is of the essence, especially nowadays. Certain hygiene rules and documentation requirements of the operation have been hence reinforced. Make sure to always strictly adhere to these guidelines. Your department head will inform you about changes of increased cleaning procedures and documenting if required. What is really important, if you have COVID-19 related symptoms, then report it immediately. To remember, symptoms are fever, cough, difficulty of breathing, and tiredness. As discussed, the symptoms are similar to those of a common cold, but we have to take them seriously and take immediate action, as it might also be COVID-19 related. So stay home and self-isolate yourself. Do not go out, neither to work nor to the clinic, as this could be high risk to spread the virus. If you're not in your room at this moment when you feel unwell, move to an area away from other people, For example, behind a closed door in a well-ventilated place with fresh air. Call the doctor immediately. He will come to you. If you're able to do so, also inform your head of department and HR that you're not able to come to work. Hence, it is best to save all the important numbers. While waiting for medical assistance, cover your mouth and nose with a mask. If not available, then use a scarf or handkerchief. This will help protecting the people around you. Also, put on gloves if available. Avoid any contact with other people and also avoid touching surfaces or objects. When coughing or sneezing, use a tissue and keep it in your pocket until proper disposable is available. If you need to go to the bathroom, you should use a separate bathroom in case you are not in your room. When the doctor is coming, he will assess you and will then take further measures according to your assessment, meaning to provide you with medicine, taking PCR test sample, which is a common method to figure out if you have COVID-19, or send you to a quarantine or isolation room or even to the hospital. Once you recovered, a medical clarification will be required before returning to work. In such times of COVID-19, social distancing and co, we might all cope with a bit of additional stress. Hence, it might be helpful to know whom to contact when psychosocial support is needed. Feel free to contact the hotline provided by the Ministry of Health via 1425 according to the times stated. By the way, if you belong to a risk group as listed here, especially if you have had a previous illness that increases the risk of contagion with COVID-19, please talk to your manager about this. There's one more measure to discuss, which is actually a local requirement we all have to follow. It is called TraceKey, which is the contact tracing app in the Maldives. Everybody living in the Maldives has to download and use it. Also, tourists are requested to do so to ensure contact tracing in case of an infection. The app states if you had a close contact with a COVID-19 case, the Health Protection Agency would contact you and ask you to upload your data then. It will also provide you with latest details on COVID-19 in the Maldives. It is available in Livehi, English and Bangla. When downloading it, you have to enter your number with the country code and your Bluetooth and app must be kept on at all times, especially when attending group events like unloading, going for dinner, etc. Here you can see a summary of all the discussed measures. And by the way, in the corner you can see the sun with a face mask. This is the symbol relating to all COVID-19 measures imposed by our parent company TUY, so you might see it quite often in future. All of these measures will help us minimizing the risk of spreading the virus, and we are all in this together, you, me, and everybody on the island. No matter if you personally consider those measures reasonable, necessary, or soever, we are all committed to complying with them. And if we do not conform, the company might face high fines, or yourself might face labor law consequences, or even worse, we might face COVID-19 on the island. I know some actions are probably not much fun, but looking at the big picture, it is a really small price to pay. So we all have a shared responsibility for the prevention and reduction of the spread of COVID-19. Therefore, we have to stick to these measures to protect ourselves, our friends and colleagues, and later on our guests too. Anyone who is planning to move from the island, please also make sure to adhere to those rules also when you are away. In regards to measures within your work field, your department head will inform and train you accordingly. Best you can do right now to conform to the measures, take good care of yourself, stay healthy, do sports, and be happy. In case of any questions, feel free to approach me. My name is Livia and I'm your crew training manager. Thank you for your attention.